Thanks very much again to our panel for a fantastic discussion. And before the noise level goes up and everybody's on their way out, we have a really important event to close out the conference, and that's the prize giving for the posters. And I know our judges have been working really, really hard, and they had a terrible hard job to try and pick a winner, but we have winners. So before we get there, I'm going to just do some closing remarks and on behalf of all of us, to do some important thank yous for today. So I'm delighted to be here to close today. I can't believe that the conference has finished. I'm sure, like many of you, it has completely captured me, and I hope that you have enjoyed the day. You will have heard over the course of the day many, many interesting inputs and thoughts about the theme for the event: nurturing a positive culture of patient safety, listening, learning, responding. It has generated a lot of really interesting themes, conversations, insights, and a collective understanding, I think, in this room anyway, to carry forward. With that ethos in mind, I have been listening and learning from the range of speakers, panelists, and from you, many of you in the audience over the course of today. And I would like to thank you all for your contribution to the event, as the level of engagement we had today is what makes events like this richer and enjoyable for everybody. We were asked last year, or we were given feedback last year, that people would like more panels, and I think you can join me in agreeing that they have worked extremely well today. We've had fantastic input that each and every one of us could resonate with the aspects of it, and there was so much learning in it. So some important thank yous, and hopefully I will manage to remember everybody that I need to say thank you for. So to echo what Kate said earlier this morning, I would really like to thank our HSE colleagues, Bernard Gloucester, Colm Henry, Orla Healy, Lorraine Schwanberg, and Angela Tinzel, for your interesting and insightful contributions to this event, with so many others in the audience and your teams that you work with every day. In particular, I would also like to acknowledge the National Quality and Patient Safety Directorate teams. You have made a stellar contribution to today's agenda, and as a result of your work, the conference was able to stream a live webinar by the QPS Talk Time team, 2 workshops on the stages of clinical audit and the importance of audit in ensuring quality and safety in our services. And you also engaged with everybody on the stand in the lobby. So to you, thank you very much. I would really like everybody to give a great applause for the work and dedication to quality and patient safety today and throughout the year. A huge thank you to Ria, who flew from Paris to be with us today from the OECD. I really enjoyed how she demonstrated the OECD's quality and patient safety data through her health economist framing. Her insights from her work in the OECD were fascinating, and that international input into our work is what we need to help us to move forward. It was a really interesting theme to open up the conference today, and certainly was much food for thought. Patient safety culture is clearly of great importance to us here in Ireland and what we do in relation to making improvements. There's a lot of realities around patient safety culture that I heard and learned today. And one theme that has resonated with me, and probably because it is part of the policy remit that I have, is our workforce and our workplaces as a major part of culture for patient safety. So really, really important themes. One, that it is hard, it's always going to be hard, and we're never going to actually get there. But that's important to all of us because it gives us the opportunity to keep growing, developing, and striving for better. And that allows us to be as creative and as flexible as we want. And we heard from our leaders this morning, we don't have to be perfect doing that. And I think that's a really important message for all of us to take home. So, moving on with my thank yous, I would really like to extend our thanks to the colleagues in Patients for Patient Safety Ireland, particularly Bernie O'Reilly, who spoke there on the panel, next steps for the open disclosure just now. And your story, Bernie, has resonated with me since I heard it last year, and it still brings a new perspective when you hear it again and just how important it is. And indeed, Katie Verling, who spoke with me on the panel this morning, and your story and your insights into how we can help each other and listen to you as patients and the patients that work with you, and how important that is. So thank you, for both of you, for sharing your stories. It's a great reminder for all of us to keep working to make continued improvements. And not forgetting your colleague, Tibbs Pereira, who was manning the stand and doing that important connecting work all day. And Tibbs, I hope to get to see you before we go. But Tibbs also has a very important contribution to the work that we do, particularly in the NPSO. Many thanks to John Brennan from ISCWA, who's delighted to see you back this year at the conference. And thanks to your colleagues, Aideen and Simon, who were working on the ISCWA stand and helped us to call for abstracts a few months ago. It was great to see my former colleague from the Department of Health, Dr. Ronan Glynn, and for his contribution on the theme this morning. I would also really like to thank Sean Egan from HICWA for his contribution in the final panel. HICWA work really closely with the NPSO, and open disclosure will be no different to our other projects, and look forward to the work that we're going to do together. Thanks also to Sean's HICWA colleagues who were manning the HRB CISR and National Care Experience Programme stands here with us today, and a really important part of the networking and learning that we've all done. Georgina Cruz, for the Patient Advocacy Service, thank you, and for your perspective on open disclosure from the advocate's viewpoint was really, really important. To my colleague Carolyn Donoghue, a fellow nurse who represented the NMBI stand today and spoke on the open disclosure panel just now. And finally, to my own colleagues in the department, the Secretary General Robert Watt, who addressed us this morning and reminded us of the importance of all of the work we do for quality and patient safety. And last, but by no means least, a really big thank you to my own team, the NPSO team. First of all, Kate, when I was standing here last year at the conference, I can honestly say we couldn't have wished for a better director to come in and have taken up post. It feels like you have been here for much longer, and I really am looking forward to where you're going to take us with your leadership for patient safety. And if today is to be any judgment of that, it's going to be a fantastic and a busy year, colleagues. And it'll be great to see what you can do with what is an amazing team. Morris, a particular mention for you today and your team for your insights on the new open disclosure framework, but also to you and the team for all the work, because we wouldn't have that framework without a significant input from yourselves. And to the rest of the team, we wouldn't be here at this point, or we wouldn't have had such a great day if it wasn't for all of your work. And these things do not happen easily. So I really do appreciate all of that. Okay, so on that point, I'm nearly at the prize giving. I'm delighted to say it's great to be standing here and say that this time last year we were waiting for our patient safety legislation. We now have our Patient Safety Act, and here we are with the National Open Disclosure Framework, which is part of what we all can take away from here and help us to do our jobs better. As you all know, the department has worked with developing the framework and conducted extensive stakeholder engagements following public consultation on this. So it is part of all of us, and that is a key message, again, in how this is going to be hopefully really, really successful. As Morris says, there's plenty of structures in there to make sure we check ourselves. So we can look forward to seeing what that story tells us this time next year. I believe the framework is going to make a significant difference in the care experience of patients and families in our health service. It will also promote and change the culture and practice of health and social care professionals in the area of open disclosure. And we've learned today how important that is to all of us, but also to our patients. I would really like to take this opportunity and acknowledge the efforts and thank everybody who participated in today. And for all of you coming here in the rain this morning, I hope that you have got out of it what I certainly have. And finally, before we move to the prize giving, just to thank OPW staff here in Dublin Castle, the AV team and the catering staff. I'm sure you'll all agree they are a very important part of us having a successful and enjoyable day. Right, I'm going to need some help up here because I have got the fantastic job, and this is the nice job, of doing the prize giving. For those of you that took time to walk around and to see the wonderful posters that we had today, you will have noticed, or you may not have noticed, the busy work that was going on with all of our judges. So we have 2 categories for awards. The first one is for AMR, the poster for AMR, and we had a judging panel that consisted of Dr. Emer Brannigan, who is the clinical lead of AMREC in the HSE, Barbara Slevin, who's an Assistant Director of Nursing in AMREC, and Aileen O'Brien, who's the Head of Infection Prevention and Control and Antimicrobial Stewardship in HSE Community Healthcare. I would like to thank all of you for your work and effort today, because it hasn't been easy. With the amount of interest that was in the posters, you nearly had to climb on ladders to do your judging, and you've done it really, really well. So you've been deliberating, and you have advised me that we have one winner for this category, that the winner of the antimicrobial resistance competition for students and graduates in the last decade is Aoife Fleming and colleagues. Aoife, if you'd like to come up to the stage here with me. Aoife's poster demonstrated a qualitative study investigating the views of nurses and doctors on the management of urinary tract infections in long-term care facilities. Incredibly important work. Is Aoife here with us? Somebody come up and take it for her. Okay, so the second competition this year was a general patient safety poster competition, where entrants were invited to display posters outlining their work related to the conference theme, and specifically how their work facilitated a positive culture of patient safety by either listening, learning, or responding. This competition category was rife in terms of the numbers. We had a total of 86 posters and entrants from across the country, and nearly every service was represented. So before I announce the winners, I would also really like to thank the judges for this competition, because they equally had a very hard job. So I'd like to thank Dr. Michael Carton, Principal Epidemiologist at the Health Protection and Surveillance Centre, Georgina Bassett, Deputy Chief Nursing Officer in the Department of Health and one of the members of my own team, and Dr. Louise Hendrick, Clinical Lead QPS Intelligence at the HSE National Quality and Patient Safety Directorate. With 86 entrants, this was no mean feat, so I'd like to thank you all for your work. And now to the prize winners. We have 3 winners in this category. So we got some feedback from the judges. The feedback was there's a great variety of innovation seen in addressing the theme, and it was really encouraging to see meaningful engagement with patients and service users as a very much a recurring theme throughout the posters. There were great examples of learning through practice and local projects with the potential for spread and scale, which is really important. There were also national projects that aligned very well to the patient safety strategy, and recurring theme of learning from data and evidence was really noted this year. The range of methodologies covered everything from evidence reviews and mixed methods to target interventions and quality improvement projects, and the learning across the posters was exceptional. Some of the work is at an early stage, and we would really like to encourage those who are planning on further research and evaluation to come back and present again next year. And we had so many exciting projects being presented here for the first time. That sets us up for even more entries next year. So that was collective feedback from all of our two judging panels today. And thank you for taking the time to bring that and to notice those really important elements of the posters and what they bring to a day like this. So I've kept you waiting long enough, I know. So I have great pleasure in announcing the third place winner for the general patient safety category. In third place, congratulations, Melissa Sharp and colleagues, for your poster on communicating evidence synthesis, co-designing summary formats with end users. I can't read the rest of that writing, so fabulous poster. Melissa, are you still with us, or is there anybody who can... Okay, in second place, we have, congratulations, Emily Carey and colleagues on a multidisciplinary team approach to review and prevention of hypoxic ischemia in encephalopathy, I think it says here. So well done. Emily's ashes. Just to correct the name, it's Siobhan Enright and colleagues. So congratulations, Siobhan, and everybody else. Okay. So first prize goes to, and congratulations to Mala Shah and colleagues for Skip the Dip for UTI in over 65's quality improvement. Very worthy prize winners, and congratulations to all of you. And in line with the judges, look forward to seeing you back here next year with your continued stories. So with that, I'm very happy to close today's proceedings. And again, thank you all for your enthusiasm and contributions over the day. Wishing you all a safe journey home.